Antibiotics. They've saved millions of lives, but it turns out we're using them way too much.
Yeah, tonight on 9 Healthline, Graham Elkins explains why the misuse could have some dangerous consequences in the years ahead.
Hey, good morning.
This time of the year, doctors start seeing a lot of people with fall allergies or cold and flu-like viruses. Many patients expect to be given an antibiotic, and many doctors often oblige. Dr. Kenny Cole, an infectious disease specialist, says that is a problem.
The question when you go to see a physician, especially for a respiratory tract infection, is not along the lines of what antibiotic are you going to give me, but more, are you sure that I need an antibiotic?
The misuse and overuse in people, livestock, poultry, and farm seafood has led to mutations of bacteria that are now resistant to those once effective drugs. The so-called superbugs like MRSA are traditionally found in hospitals and nursing homes, but they're now spreading into the general population.
We are seeing similar patterns emerge even within the community just because of the overuse and the injudicious use of antibiotics in the community.
The CDC reports 2 million cases of drug-resistant infections in the U.S. per year, with 23,000 deaths. They also say nearly half of all antibiotic prescriptions are either inappropriate or unnecessary. Most viruses, like the common cold and flu, will not get better with an antibiotic like Zithromax or the Z-Pak, and taking one may actually be doing more harm than good.
There are some experts who would say that we are in danger of a post-antibiotic era.
Dr. Cole says you should not be afraid to challenge your physician instead of demanding an antibiotic. If you actually do have a bacterial infection, it's important to take all of the antibiotic you're prescribed.
The patient clinically gets better from the infection and feels fine, but because they didn't take the entire course, that can then allow for resistant strains to kind of proliferate and grow, unaware to the patient.
Hospitals around the country, including Baton Rouge General, now take part in antibiotic stewardship programs to stop all the misuse. But patients must also do their part to squash the superbugs. Graham Elkins, WAFB 9 Healthline.